Good afternoon, everybody. Thank you for coming today to get an update on COVID-19 in King County. I'm Hillary Karras with Public Health Seattle and King County, and I would like to first introduce our director, Patty Hayes.
Good afternoon. I'm Patty Hayes, Director of Public Health Seattle, King County. I want to thank everyone coming today and joining us as we share an important update on coronavirus here in King County. I'm joined today by Dr. Jeff Duchin, who is our Health Officer for Public Health Seattle, King County, Dr. Kathy Lofi, who's the Washington State Health Officer, Dr. Frank Rito, who is the Medical Director of Infection Control at Evergreen Health Hospital, Dr. David Knopfler from Overlake Medical Center, and our King County Executive Dial Constantine. So with that, I'll turn it over to Dr. Duchin for the initial update.
Thank you, Patty. Thank you for joining us this afternoon. Today, Public Health Seattle and King County is announcing 3 new presumptive positive cases of novel coronavirus, COVID-19, including 1 person who died. And I want to just start by expressing our deep and sincere condolences to the family members and loved ones of the person who died. 2 of the confirmed cases are associated with Life Care Nursing Facility. It's a long-term care facility in Kirkland, Washington. 1 is a healthcare worker from Life Care. She's a woman in her 40s. She's in satisfactory condition at Overlake Hospital, and she has no known travel outside of the U.S. The second case is a woman in her 70s, a resident at Life Care, the long-term care facility, and is in serious condition at Evergreen Hospital. In addition, we're aware of a number of individuals associated with the long-term care facility who are reportedly ill with respiratory symptoms or pneumonia, and we're in the process of investigating this situation as an outbreak. We're in the beginning stages of our investigation, and new details and information will emerge over the next days and weeks, and we'll keep you updated. The person who died was a patient at Evergreen Hospital who had underlying health conditions. It was a male in his 50s. He was not a resident of the long-term care facility. We are now in the process of working with the long-term care facility with the support of the Centers for Disease Control and Prevention. Our CDC colleagues are coming out. We have a team arriving tonight. We'll have additional help on the ground from the CDC tomorrow. And we're in the process of providing support to that facility to care for the infected patients, to protect the uninfected patients, and to provide infection control guidance for their staff. At this point, I'm going to stop and turn the podium over to Dr. Kathy Lofi, who is our State Health Officer. Actually, before I do that, Kathy, let me just remind people a couple of things. First of all, novel coronavirus infection, as has been recognized, is spreading globally. And we are having increasing cases in the United States, and we expect to see increasing cases locally. It's very important for everyone to remember that 80% of the cases are mild. Patients frequently don't even need to seek health care. You can think of it as a bad influenza-like infection. However, as these recent cases demonstrate, it can be severe. And we want people to understand that there are things that they can do to protect themselves from getting this infection, just as we can do things to protect ourselves from getting influenza. Hand washing. More hand washing, less face touching. Staying away from others who are ill. Please don't go to work or school if you yourself are ill. We can think about what might happen if we see more cases, which would mean possibly telecommuting, businesses having fewer people coming into work, either because they're sick or they're trying to minimize face-to-face interactions, social distancing that we will recommend so that people put more space between them and others so they're not likely to get sneezed or coughed upon. So there may be times when we would ask people to avoid going to large gatherings, to avoid congregating in public settings like sporting events, social events, and so on. But at this point, we do not have widespread community-wide transmission locally. We have transmission that's associated with an outbreak at this long-term care facility. So we're going to be watching the situation very closely, and we're going to be providing guidance as we learn more. At this point, I would say everyone should take the basic precautions: hand washing, more hand washing, less face touching, social distancing, not going to work or school when you're sick, staying home when you're ill, thinking ahead as to what might happen if people in your family become ill, how you'll care for them, if children are dismissed from school, who can watch them, if you've got people in your home who are older or vulnerable, how you'll take care of them, if we have social distancing and people are requested not to go out frequently. Have medications in your home so you don't have to go out and refill a prescription if you don't need to. Have some foods that you like to eat handy so you don't have to go to the store if you don't have to go out and be interacting with other people and touching other surfaces. And finally, it's really important to know that as with seasonal influenza, the people who are at greatest risk for novel coronavirus infection with serious outcomes are elderly, so we will say, as we do with influenza, over 60, over 65, and who have underlying health conditions, chronic cardiac disease, lung disease, diabetes, and the other conditions that we're concerned about with influenza. Pregnant women, perhaps, people have weakened immune systems. These people in these groups really need to pay attention to the guidance about hand washing, not being around ill people, and trying to minimize social interactions at this time to the greatest extent possible. So with that, I'm going to introduce our State Health Officer, Dr. Kathy Lofi.
Great. Well, thank you, Dr. Duchin, and good afternoon, everyone. My name is Dr. Kathy Lofi. I am the State Health Officer at the Washington State Department of Health. I want to begin by echoing the sentiments from those who have spoken before me. We send all our deepest condolences to the family of the person who died. We also want to extend our support to the healthcare workers who are caring for impacted people at this healthcare facility where COVID-19 has been confirmed. I'm going to now echo, I think, some of the comments that Jeff made. The COVID-19 situation is rapidly evolving on the global, on a global scale. And in Washington, we are starting to see some spread of this virus. Therefore, we do feel that the risk to the general public is increasing. But as Dr. Duchin said, we do not feel that the risk, that transmission is occurring on a widespread basis by any means. Therefore, this means that it's more important than ever for people to practice good health habits, such as washing your hands and staying home from work and school when you're sick. Should we start to see more spread in Washington, we might consider some measures, such as canceling large public events, but don't really feel like that is the situation we're in now. Now that we can test for COVID-19 at our state public health laboratory in Shoreline, we're able to get the test results back much faster, and this will allow us to identify cases and offer key guidance to impacted communities in a more timely fashion. And in closing, I also just want to reiterate that it's important for people to remember that most people with COVID-19 do have mild illness. A smaller proportion will have severe illness, and that is why we are working extremely hard to try to decrease the spread of this virus in Washington. And with that, I will turn it over to Dr. Frank Rito.
Hello, Dr. Francis Rito. I'm the Medical Director of Infection Control and Prevention at Evergreen Health. Evergreen Health is a public hospital district that serves Northeast King County, South Snohomish County. We're a community-based hospital. With the updated guidelines for testing, we initiated testing in 2 individuals who we felt had high risk based on symptoms alone. There was no epidemiologic link to travel, and both of those individuals tested positive. That initiated a cascade of events. And at this point, really close cooperation with Seattle-King County Health Department, with the State Department of Health, with the Centers for Disease Control, and with our Northwest Healthcare Response Network. We are continuing to care for the individual who has survived. We have expressed our condolences to the families of the individual who has passed away. We have additional individuals that are being tested, and in conjunction with the State Health Department and the State Lab, we should have additional information later today. I want to thank everybody who has participated in our effort, and it's been a big shift.